Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we'll talk to Amy Myers, Director of Marketing and Community Relations for Novant Health Brunswick Medical Center, regarding the new Novant Health brand and promise. We'll also speak with Ben Styers and Tait about the Brunswick Medical Center Foundation and their upcoming flip-flop ball. Finally, our last guest will be Dr. Mary Sauer, a gastroenterologist with Wilmington GI. Stay tuned to learn about valuable health topics with Health Watch. Our first guest today is Amy Myers, Director of Marketing and Community Relations for Novant Health Brunswick Medical Center. Well, Amy, welcome back to the show. It's such a pleasure to have you here today.
Thanks for having me. I'm glad to be here.
Well, you're welcome. For our viewers who haven't met you before, why don't you tell us a little bit about your role at Brunswick Medical Center?
Sure, I'd be happy to. I've been at the hospital, I guess it'll be 7 years coming up, which is hard to believe. My title is Director of Marketing and Community Relations, but really kind of involved in a lot of things at the hospital. Marketing and Community Relations, certainly a big part of it, but also our foundation, which is the fundraising arm of the hospital. And I'm also involved from an oversight standpoint with our guest services and volunteers and chaplaincy programs. So I have a really fun job. I get to work with a lot of the really fun parts of things at the hospital and love working alongside the doctors and the nurses and the staff at the hospital as well.
Wow, you are a busy young woman.
Well, some days it does feel that way.
We're here today to talk about the new name for the hospital.
That's right.
Okay. So tell us about this new logo and the brand that was recently implemented.
Yeah, it's been a big change, and you'll probably find all of us kind of tripping over our words as we get used to a new name.
Yeah.
It's a big change for us. We essentially have changed our name across the whole Novant Health system to the leading brand of Novant Health. And in our area, that doesn't seem entirely unusual because we already had Novant in our facility name.
Right.
But we were the only hospital in Novant that used that word in our name at all. So it's a big change across the system. And for us, what it means is when we answer the phones now, we answer them Novant Health instead of with our Brunswick facility name. When you see our signs, you see Novant Health Brunswick Medical Center. So it's changed our name. We've also changed our logo, the new look and feel to our logo. It's essentially a large N with a colon and then the words Novant Health beside it. And if you see it, there's kind of a hidden message in it that some people see right off the bat, and some people it takes a little longer to see. And what that is right where the colon is, there's actually a hidden H, which is kind of gives indication of the hospital sign that we've always seen for so long.
Oh yeah, I didn't think of it like
and I guess
that.
Yeah, exactly. It's kind of a fun element to the logo. So it's just a strong new identity for us. And the really great part is, tourists, for example, are in Charlotte. They always knew Presbyterian Hospital in Charlotte. Now it's Novant Health Presbyterian Medical Center. It's the same logo, that same N with the colon and the Novant Health. So when they're in Charlotte or if they're vacationing here, they know that we're family, we're related, and I think that's a real benefit to people. If they're comfortable with that hospital, they can know they can be comfortable with this one as well. So we're excited about that.
Great. Well, what about the color? I hear there's a new color scheme going on.
Yeah, I did forget to mention that. It is. The new color is called aubergine.
Okay.
It's a new word to all of us. I think we've all been learning that one.
I like that word.
Yeah.
It's kind of cool.
Very good. It's essentially, if you look it up, sometimes people will say it's kind of an eggplant, purple. So we're getting used to calling it aubergine, but people are really excited about it. It's distinctive and different, something that, while a color doesn't matter in a huge way, it does help us to stand out and hopefully be more recognizable.
I think you'll stand out because not too many facilities utilize that color.
Yeah. And we hope that that's a benefit to the public because, if they're looking for us and they can easily identify us because of a color, that's a good thing.
That is a good thing. That is a good thing. Well, when does all this occur?
We actually launched the new brand on April 17th. So that being said, it's just been a few weeks, and knowing that, you'll still see the old logo for some time. Kind of what prompted this whole change was that the logo we had worked for a long time. It was kind of the green and blue with what we called the delicate arch, probably more commonly called the swoosh or the eyebrow, something like that. But if you, and a really observant consumer, a community member might notice that all of our physician practices and all of our hospitals had that, but you kind of had to really pay attention. Now it's much easier to see, but you're still going to see that delicate arch around probably through the end of the year. It's going to take us some time to make the transition, so we've changed key signs and things like that, but it'll take a little while to get all our forms and uniforms and things like that changed.
Well, I imagine there are some extra benefits to having all the Novant hospitals utilizing Novant Health in the title. Talk to me a little bit about what you think some of those advantages might be.
Well, I think, kind of to speak to what we said before, just recognizable in all the communities we serve, so that's one really great benefit. In addition, we're really proud of what the Novant Health hospitals have been doing, in particular in the quality realm, quality of care. And in the past, you could look at a list of, say, the top 20 hospitals in the state from a quality of care standpoint, and you would never notice that probably 10 to 12 of them were Novant Health facilities, because based on our names, you didn't see that. But now you'll know. And so I think that's a real strong benefit to the community in knowing the benefits that the Novant Health system offers to patients.
So is this just a name and a logo change across the system?
You're right. That's what we've talked about mostly, but what we've asked employees and physicians to leave with is really that it's not just about a logo and a color. It's really about a new promise that we're making to the community, because that's really what a brand is. We've got a new logo, but a brand is really what you want to promise to your customers, your community. And for us, that promise really centers around making healthcare remarkable. We want to bring healthcare to people in an easier, simpler format. One of the key phrases is when and where you need it. So we want to offer the world-class technology and care that you expect, but what healthcare in general as an industry hasn't done a great job of is the when and where you need it, making it convenient and simpler and affordable, because really we know hardly anyone wants to be with us. We joke that it's maternity, people having babies, and plastic surgery. Ooh, that's about the only time that you really want to be with us. Otherwise, your goal is to get back to the life, to get back to your family, to the things you enjoy. And so we want to make it easy, simple along the way, because you're going to have to interact with the healthcare system at some point, and then make that easy so you can just get back to what you really want to do. So that's really the promise. Which is
it is more than just a new face or a new logo.
It absolutely is.
That promise.
It is.
You're going to get that same remarkable health care that you get at all Novant facilities.
Absolutely.
And it'll be an easier experience.
That's right. And it is a change for us, because I think we've always focused on wanting to have a great experience, but the when and where you need it, simpler, more affordable. We know we still have work to do along that path, and we've got some changes that we're implementing now to help us meet that promise that we're making to our communities.
Well, what changes will patients in the community see as a result of this new brand?
Yeah, well, I think, at face value, new signs, some new uniforms. Our guest services staff at the front desk are actually going to start wearing the aubergine. Our volunteers are going to be wearing aubergines, so they'll be very recognizable. You know, our paperwork will change, all those kinds of things. But in addition, what I hope, and what leaders across Novant Health hope, is that you'll see a new commitment to that promise and all that we're doing as well.
And is that how it will impact the employees fulfilling that promise?
It is, essentially, and we've tried to really work with employees to get them very excited and engaged, and they are on board in a huge way. Wow. And excited about this change and ready to share it with our communities.
Well, it's been a pleasure talking to you about this. I think it's a great thing for Brunswick County, and I look forward to seeing that new aubergine color.
Yeah, thank you for the opportunity to be here. We appreciate it.
You're welcome. Our next guests today are Ben Styers and John Tait, co-chairs for the upcoming Brunswick Medical Center Foundation Flip-Flop Ball. Welcome to the show, Ben and John.
Thank you, thank you.
It's a pleasure to have you here.
Well, it's nice to be here.
Great. Now, to get started, why don't you tell us about your role with the Brunswick Medical Center Foundation? Okay,
I'm chairman of the board for the Medical Center Foundation.
And John, what do you do?
I'm new to the board. I don't know that I have a specific role yet.
Not yet, but you'll get one.
I'm filling in wherever I'm needed right now.
Great. Well, I know this is a side job for you guys. So tell me about your primary roles in the area. And John, we'll start with you this time. What do you do for a real job?
My day job, I'm a certified financial planner with Raymond James. And on the side, I also moonlight as a town councilman for the town of Leland.
Oh, that's an impressive job.
I was surprised to get elected after having only lived in the community for a relatively short time, but it's very worthwhile occupation to have.
Well, that's great. And Ben, what is it that you do?
I am a realtor with Southport Realty in downtown Southport.
You sell lovely downtown Southport.
Lovely downtown Southport.
That is great.
Selling real estate on the front porch.
Well, we're here today to talk about the Brunswick Medical Center Foundation and one of the upcoming events. But before we talk about the events, let's talk about the purpose of the hospital's foundation. John, could you help me with that?
Really what we try to do is take what we do inside the walls of the hospital, which is improving the health of the residents of Brunswick County, and we try to take that beyond the walls into the community and do specific things to improve the health and wellness of our residents without having them come into the hospital. And Ben knows a little bit more about that.
I do. We have a women and children's wellness outreach that we're trying to pinpoint obesity in the children, smoking with the pregnant moms.
Oh, that's a biggie here, isn't it?
It really is. And gosh, just, you know, breastfeeding has become a thing of the past. We're trying to get that back as a natural.
Trying to increase that now?
Yeah, trying to increase that.
Yeah. And I heard something about a courtyard that you're trying to build in relation to the hospital, just a respite area. Can you tell me a little bit about that?
It is a respite area. It's going to be outside the cafeteria, and it'll be walled in, tables, some kind of coverings. I've seen the drawings, but
I'm sure it's beautiful.
It's going to be beautiful.
And I think you sold bricks.
Bricks,
didn't you? And will those be showcased in that area?
Yes, they will. And they'll have each donor's name imprinted on the brick, engraved.
Well, that sounds pretty neat. I'm excited about that. So I know that to raise money, you've got some things coming up, some events, and one of them is a hospital ball. So let's talk a little bit about that hospital ball.
Okay, this was our second ball. Last year was Evening in Paris.
That was fun. I was there. Fun? That was gorgeous.
Yeah, everybody had a good time, I think. Yeah. We had a good turnout. This year we're going to have an evening in Key West.
Wow, that sounds awesome.
It's the flip-flop ball.
Oh, wow, that's even better. Anytime you can wear flip-flops, that's a good thing.
Absolutely.
So your event is the flip-flop ball and something about Key West, am I correct?
It is. It's about Key West, and we'll have a venue at
Sea Trail Convention Center.
Thank you, thank you.
That's in Sunset Beach, right?
Sunset Beach, it sure is, yeah. And we'll have Mallory Square kind of a setup with streetwalkers maybe, and probably some prizes, some giveaways, hopefully pretty nice ones.
And there'll be flamingos.
We hope so. Maybe not live flamingos, but
Oh,
at least
no.
some plastic
Come
ones,
on,
maybe
don't
with
tell
some
me
blinking
that.
lights.
And how about a band? I hear there's a great band. Is that right?
Well, there is a great band, Land Sharks. They're from Florida, and they've played with Jimmy Buffett and the Beach Boys. So we're looking for a great evening of entertainment.
Oh, that sounds great. Well, tell us when and where.
The date of the event is going to be June the 1st. It's a Saturday, and it starts at 6 p.m.
Wonderful. And it's at?
The Sea Trail Convention Center. Tickets are $75, and if you'd like to purchase them in advance, you can call 910-721-1460.
Great. Well, that's just around the corner, isn't it? The June 1st.
It is.
It won't be long. What else can attendees expect at this event besides flamingos?
Well, we should have some pretty good food, Key West style food.
Really? Is that like coconut shrimp and key lime pie, maybe?
I think probably
We hope so.
I think
I would
probably
hope
so.
so. And you say it's a Mallory Square environment, right?
Yes.
So maybe you'll have some street entertainers.
Maybe
and
street
some-
entertainers, stilt walkers. It's hard.
Really a type of event where you can just come and relax and enjoy good people, good food, and good music.
And so tell me about what you have on today. You look sort of ready for, you didn't send me the memo, guys. What's happening here? I didn't know.
That looks pretty Key West to me.
I'm pretty colorful, but you guys are really Key West out. So is this an example of the attire that would be appropriate for this event?
I think it
I would
is.
think
Shirts
so.
are required, flip-flops are optional.
Yeah.
Okay, so we can wear shorts.
Shorts?
Shorts
Shorts.
okay?
Absolutely.
Short-sleeve shirts.
Absolutely.
Really, anything goes in Key West, or so I hear.
Well, that's true. Well, you can sign me up for this one because I really want to be there.
All right.
Well, I understand there's a couple of other events planned for this year. Let's talk about those for a little bit.
Okay, we have a golf tournament coming up on September the 20th at Lockwood Folly.
Oh, that's a nice course.
It is a nice course. We had our event there last year, a very good turnout. A lot of people were coming back, they said.
And I think there's some sort of a wine and shopping thing going on. Tell me about that, John.
That's right. It's going to be an evening of wine and shopping, probably some shoes in there somewhere. And
Oh, my.
it's going to be November 2nd, and it's going to be held at 101 Stone Chimney Place.
I think you know that place very
I
well,
do,
don't you, Ben?
I do, yes.
Well, it sounds like a really busy year for you guys, and we've enjoyed having you on today. Is there anything else you'd like to add? Let's do the phone number one more time and the ticket prices and
Okay,
such.
for the June 1st event, which is the flip-flop ball, tickets are $75 a piece, and the phone number you can call is 910-721-1460.
1460. Well, great.
And we do have sponsorships available from $250 to a $5,000 level.
So we're still looking for sponsors.
Still looking for sponsors.
And of course, we want ticket sales to go through the roof, right?
Absolutely we do, yes. It's going to be a great evening.
It sounds like it. Well, thanks again for being here. It's been such a pleasure having you both on, and I look forward to seeing you all at the Flip Flop Ball.
Thank you.
Thank
Look
you.
forward to having you there.
Thanks. Our last guest today is Dr. Mariam Sauer, a gastroenterologist with Wilmington GI. Welcome to the show, Dr. Sauer. It's such a pleasure to have you here.
Thank you, June.
You're welcome. And to begin, can you tell us a little bit about yourself, in particular your education and your background?
Yes, I am originally from Charlotte. I'm a native of Charlotte, and my husband is from North Carolina as well. I trained in Chapel Hill, my undergrad and my medical school. After that, my husband and I thought that maybe we'd like a little change of scene, so we moved to Chicago, and I trained at Chicago, the University of Chicago and Loyola. But then we had kids, and we decided to move back home. Our family is all in North Carolina, and we really liked this area, southeastern North Carolina, and that's how we ended up here.
Well, great. We're glad to have you.
Thank you. We love it here. It's a wonderful
sure.
place to live.
Yeah, it is a great place to live. Well, I understand you're with Wilmington GI, and so I'd like to hear about your group and where you're located. Let's start by talking about your group.
Well, we are 7 gastroenterologists. There's myself, and I have 6 partners. We are located in Wilmington, but we also work in Brunswick County at the hospital. We really hope to expand more into Brunswick County and eventually have a clinic here and have a big presence in Brunswick County. Right now we're doing procedures at the hospital, but like I said, I hope that will expand. Most of our services are in Wilmington. We're located on Oleander Drive. Anybody that might know Wilmington, we used to be the old bowling alley. We resurrected that building and we made it into our practice. We do everything within GI and liver disease. So we see simple things, we see very complicated things, and we do everything in between.
Wow. Well, some of our viewers may not know what a gastroenterologist does exactly.
Yeah, good point.
So let's talk about that a little bit. Talk about your specialty and what it is you do.
Yeah, gastroenterology encompasses a lot of different things. Even though we are specialists, we see a lot of different diseases and different organs. We treat diseases of the stomach, the intestine, that'd be the small intestine and the large intestine, which is the colon, pancreas, liver. We treat diseases in all of those organs. Some of the more common things that we see is reflux or heartburn disease, constipation, diarrhea, irritable bowel, celiac disease. We also see advanced liver disease. We see colon polyps, colon cancers. So there's a lot of variety within GI. We not only see patients in our clinic, we also do procedures. So we all do colonoscopies and upper endoscopies, which we'll talk about here shortly. But GI really encompasses all of those disease categories and all of those organs as well.
Wow, that's a lot.
It is. It's a lot. It's very interesting work, though.
Well, our main focus today is to talk about one of your specialties, colonoscopy screenings. So let's start with the basics. What is a colonoscopy exactly, and why is it important?
Oh, that's a good question. So colonoscopy, we do this procedure, it's a procedure, and we do it for many reasons. It's important for many reasons. The most common thing that it's done for is colon cancer screening. Why is this important? Colon cancer is actually the second leading cause of cancer death among people over 50 years old.
Wow.
It's actually the third most common cancer in women and men in the United States. There are different ways to screen for colon cancer, but the way that we use in the United States is colonoscopy. Almost all colon cancers start from polyps. Polyps are growths on the lining of the colon. We are able to directly visualize these with the colonoscopy. And a colonoscopy is just a small, flexible tube with a camera. It allows direct visualization of the entire colon. If we see anything like a polyp, we are able to remove it. If we see anything abnormal, we are able to biopsy it. It's very unique in terms of screening because we are not only able to see things, we're able to do things at the same time. It's unlike a mammogram per se. If you have an abnormal mammogram, you have to come back at a later date for your biopsy. This is not true with a colonoscopy. We're able to do everything at once.
Right then.
Now, we do colonoscopies for other reasons, diarrhea, constipation, changes in bowel habits, things like this. But most often it is used for colon cancer screening. And June, did you know that if everybody had a colonoscopy that actually needed one, that we would be able to reduce colon cancer by 60%?
That's astounding.
Yes. Only 1 in 3 Americans who need a colonoscopy have actually ever had a colonoscopy.
Wow.
It's amazing numbers. It really is.
That is. Well, how often should a patient have a colonoscopy, or when does that begin?
Good question. Yes. So it's different. The average age is 50 years old. So if you're just a normal person, no symptoms, no family history, you should start at 50, not a year later. It's very important. That's when the risk of colon cancer really goes up, is with age. If you have symptoms, and symptoms include changes in your bowel habits, constipation, diarrhea, rectal bleeding, abdominal pain, weight loss, you should come in earlier. If you have a family history of not only colon cancer, but colon polyps, you need to come in earlier, and that generally is 40 years old. But it may even be earlier. If there's any questions, just talk to your doctor. They'll be able to help guide you in that.
If you have none of those indicators, and you've had your first screening one and it was fine, what would be the next one? When would you have the next one, and how many years?
There's different variables in that, but most often it's 10 years. If you have a totally normal colonoscopy, nobody in the family had colon cancer or polyps. Sometimes, if you have polyps especially, or sometimes depending on your preparation, if some things change in your family history, you may have to come back earlier. But it's not something that's done every year per se. Usually it's within 5 to 10 years.
I see. Well, it sounds like it might be kind of scary, and that's why people aren't getting scoped at the rate that they should be. And so what can we, how can we encourage folks to do it? Is it painful? Is it not painful?
Yeah, these are good questions. There's lots of barriers to colonoscopy. Pain is one of them, and I think people have a misperception about that. It actually is painless. At our facility here at Brunswick and at Wilmington GI, we offer painless colonoscopy. We use very advanced sedation, very close monitoring. We are with you from beginning to end. Most people take a nice nap, wake up, and we are completely done.
Don't even remember.
Don't
right?
even remember. There is no pain involved in that procedure. There's lots of other barriers to having a colonoscopy. I would say the one that I hear most often is the prep. It's actually the day before the colonoscopy.
I would vouch for that one.
Yes. And, you know, I think people are often pleasantly surprised because the prep is still the worst part, in my opinion. We've come a long way with preps, though.
Right.
They are much more palatable these days. It's still a lot of volume that you have to drink, but a lot easier to do. And in all honesty, I would rather drink a prep than have colon cancer.
I hear you.
Like I said, if many people were screened, we'd be able to prevent a lot more colon cancers.
Right, and you're right. Once you get past the prep, it's a piece of cake.
It really is a piece of cake. And
you don't remember anything.
You're exactly right. And people are often pleasantly surprised by this. I have patients tell me every day, wow, if I had known it had been this easy, I would have done this years ago and just had it off my mind. Because like I said, once you get it done, you usually don't need it for many, many years.
Right.
Your family will stop bothering you about it. Your primary care doctor will stop bothering you
Yeah,
about
really.
it. Your gastroenterologist will stop bothering you about it. So I always tell people, don't let the fear stop them, because honestly, it's not as bad as one thinks it's going to be.
Now, you said patients take a little nap and they wake up and they don't remember. And I assume that's a type of sedation that you use. Let's talk a little bit about sedation and how that's administered. And
Yes, so the day of the procedure, everybody gets an IV, and the sedation that we use goes through the IV. The sedation that we use is very quick on, it's very quick off. The day of the procedure is a day of rest, but it's not like the old days when you would be groggy all day and really didn't have any quality of your day that day. And like I said, we do very close monitoring during the sedation because it is IV. We give everybody a different dose. We only give you as much sedation as you need. And everybody is awake, walking and talking, knows what's going on, is coherent before they leave. It's not the typical sedation that you have if you undergo a deep anesthesia, let's say for a big operation or surgery. And there are some people that are fearful about the sedation. Many people who want to have a colonoscopy have never had sedation before, and they are fearful of that. But again, it's not the deep sedation of big operations, and that should not make you fearful either.
so if a patient wishes to have their procedure at Brunswick Medical Center, where would they need to go for a pre-colonoscopy appointment?
Yes, that's a good question. They can call our office at 910-362-1011 or at wilmingtongi.com. We will arrange everything. It is not necessary to come into Wilmington for that. We are able to do visits, the pre-visit at Brunswick. Certain people qualify for that, but if you just need your average colonoscopy, we are able to do that, and you can save yourself a visit into Wilmington for that as well. So it's much easier than one may think.
So they wouldn't need to travel to Wilmington,
No.
and your office could determine whether or not they would be appropriate.
That's
to have
exactly
it here.
right. That's exactly right.
One other question I have, is a referral necessary?
No, a referral is not necessary. If you are over 50 years old and you have never had a colonoscopy, please call our office. We are happy to schedule you without a referral.
Great. Well, before we wrap up, let's share again your phone number and how folks can go about scheduling their colonoscopies at Brunswick Medical Center.
910-362-1011 or at wilmingtongi.com, or you can visit us on Facebook as well.
Oh, wow. And they can just let your office know that they're from Brunswick County and they would prefer to have
Absolutely.
their colonoscopy at Brunswick Medical Center.
That's exactly right, and we'll facilitate everything.
Great. Well, thank you so much for being
Thank you,
here
June.
today.
It was a pleasure.
What a pleasure. And
It's a
I've learned
pleasure.
so much today, and I hope our viewers will feel confident and safe about having their colonoscopy.
Exactly, and I just want to say one last thing. Please get screened. If you have not had colon cancer screening, please do so. Thank you.
again. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see on a future show, please email them to atmctv@atmc.coop. For more information on Brunswick Medical Center, local doctors, and general health information, please visit novanthealth.org. Thank you again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
This is ATMC TV Channel 3. We bring you the best of Brunswick.